Hello and welcome once again to Coastal Experts. We are joined today by Dr. Megan McGovern. She is with Coastal Empire Plastic Surgery, and we know that, having talked before, that you specialize on the area of the face. So let's talk a little bit about some of the things that are available. And there are neurotoxins and fillers. So what's the difference and how would I know which one to use?
Both are useful. Neurotoxins like Botox, Dysport, and Xeomin are the main ones that we have. They relax the action of the muscle. So we scowl, we frown, we squint, we do things that we're really kind of consciously unaware of, and we can relax those a little bit with neurotoxins, Botox, Dysport, Xeomin. Fillers, we have so many choices with fillers now, and it's wonderful, but can be confusing as well. They're restoring volume. So we use filler to restore where we've lost volume. We also use fillers to speckle and smooth. So we have real thin fillers that can't add volume but can only smooth and sort of line chase and erase those lines. So we have lots and lots of choices, and together relaxing the muscles so everything looks more relaxed and smooth and all those things, and then adding a little bit of volume or spackling and smoothing can help in both ways.
All right, now I've also heard a little bit about hyaluronic acid. Now, what is that and does it really work?
Hyaluronic acid is what most of the fillers are made of. There's some other things available that aren't made of hyaluronic acid, but the reason there's so much of it is because it can be used in lots of different ways, and it's very well tolerated. It's human form hyaluronic acid, and we have two main companies, but there's some other ones catching up. So there's Restylane and there's Juvederm. So the two companies have different formulations of hyaluronic acid that are put together in different ways. So they either add that deep volume that lifts and restores volume, or it's really thin and spackly, depending on how it's cross-linked and how it's formulated. So we can use it in different layers of the tissues to achieve the results we're looking for.
Okay, so that's great, because then there are options based on what you need, and that's what you do in a consultation, is help to recommend those things.
Right.
Now, one of the things that's all the rage, particularly on social media, is platelet-rich plasma. So tell me about that, and how does that work?
So PRP, platelet-rich plasma, which is harder to say 3 times fast. So PRP is we harvest from you, we draw some blood, we separate the PRP out, and then depending on what we're doing with it, we concentrate it in different ways. And we can do it associated with microneedling and put it back into your skin, and that stimulates collagen production and smooths at the skin level. We can use it in deeper ways to remodel underneath the tissues. It doesn't really bulk like filler does, but it can do some smoothing and collagen building. We actually can really concentrate it and use it in your scalp, and we're growing hair in people who are starting to lose their hair. Mostly in men, but we've done some women also, because sometimes women have the thinning hair, and especially at the hairline it starts receding back a little bit, and we can stimulate the hair follicles to start growing again. So there's lots of different ways we can use it, and it really does work. It really is useful.
Okay. Well, we talked a good bit about injections. Now, what about radio frequency and lasers?
So when we're doing rejuvenation of different types, and lasers and radiofrequency and high intensity ultrasound can be used to target different layers of your skin and soft tissue to stimulate collagen and elastin production. So depending on what areas are bugging you, we can start deep and remodel from the inside out, or we can start top down and deliver energy to the surface, so we're treating the skin. And depending on whether you're comfortable with some social downtime, we can do some things that give a little bit more early gratification, but may have little pin dots for a few days. Or we can do some treatments that really are gradual, and you do them, several treatments over time, but you have no social downtime. So we've got radiofrequency, and we've got laser, and we've got ultrasound, and lots of different ways of delivering that energy. It depends on what our goals are, to which one we're going to do. Doing those in conjunction with moderate amounts of Botox or Dysport or Xeomin, moderate amounts of filler, as opposed to filling all the lines with so much filler, they're all smooth, but you look like the Stay Puft Marshmallow Man. So doing little bits of everything can help you look more normal and natural. Really the goal with all of these things is to look like we were never there, but we're aging gracefully. So I want you to look normal and human and like yourself, but refreshed. And each one of these can help us achieve that in sort of different ways.
And that's what I love about talking with you, Dr. McGovern, is that there are all these things that are available to us with the injections and fillers and radio frequency and lasers, but your goal is to make someone feel comfortable in their skin. And
Absolutely.
I love that about your approach. If you have questions about plastic surgery, please go to our website at wsav.com, click on Coastal Experts and submit your questions, or reach out directly to Coastal Empire Plastic Surgery and see what Dr. Megan McGovern can do for you.